Welcome to Caregiver Relief. This is Diane Carbo, your host today, and our hot topic for today's presentation is activities for people with dementia. Let's get started. Activities for people with dementia are important at all stages of the disease. These activities will vary depending on the stage of the disease, the physical and cognitive ability of the person with dementia, as well as their age. The goal of these activities will be to offer variety to achieve things such as helping the person with dementia remain happy and positive, which is essential to staving off depression, maintaining a level of self-worth in those who are in the earlier middle stages and to improve their sense of well-being. Maintaining some level of physical and mental conditioning is important. For some, this may even slow the progression of the disease. These activities can also help care partners. Taking care of somebody with a debilitating disease can be challenging for anyone. This is true no matter how strong the relationship between the caregiver and the family member was to begin with. A focus on special routines and practicing mindfulness can be beneficial to both the caregiver and the family member. This is usually pivotal in enhancing patient care. It has also been shown to delay cognitive decline. It also decreases the stress levels of the caregiver, as they are less likely to find the task of caregiving unmanageable. Choosing the right routines will help the patient find the kind of structure that helps them to overcome some of the challenges they face. And for the caregiver, this lessens the workload, as it is easier when the patient, easier as it is for the patient, the less challenging things will be for the caregiver. It also helps strengthen the bond between the patient and the family member caring for them. Many of the ideas for keeping the patient mentally and physically occupied involve the caregiver as well. And the caregiver benefits directly by learning new ways to cope with some challenges they face. Some activities for people with dementia. The types of activities for individuals with dementia can depend a great deal on the stage they are in and the type of dementia they are suffering from. The truth is, people coping with this disease can still enjoy a range of activities. Since dementia, such as Alzheimer's disease, tends to rob sufferers of their memory games are very important in the early stages of the disease. In the early stages of dementia, many people can still follow instructions. It is a good idea to encourage games that call for remembering things and talking. Memory games or brain games, such as playing cards, reciting nursery rhymes, board games, or even talking about history or life events, are great activities. Some activities you may want to partake in are puzzles and card games to help sharpen the memory. Simple crafts or activities that your family member enjoyed before, they may enjoy again. Basic household tasks will not only help keep the person with dementia active, it allows them to continue to feel useful and independent. Of course, listening to their favorite music not only helps provide memories for them, it's also a great way to relax. Outdoor activities like gardening or light yard work are also morale boosters. In the very early stages of dementia, depression may follow once a person has been newly diagnosed. This person may not want to do anything. They would lose their motivation. Getting the person with dementia interested in something they like is especially important at this stage. It can, however, be proved to be a difficult task for you to encourage and motivate them. Journaling is a popular and useful activity to help those in the early stages to deal with their feelings and the emotions they are going through. As physical abilities and the senses decline, it is important to incorporate movement into their life. Dancing or even taking walks and talking are especially beneficial. If the person is still able to do simple tasks such as cleaning, folding clothes, or other basic tasks, these should be encouraged to do so. Here is a list of some simple, pleasurable activities that you may want to consider in the early stages of dementia. Read the daily paper or Reader's Digest out loud. Ask a friend with a baby or a child to visit. Plant seeds indoors and out. Take time to look at family photos and enjoy them. Say, "Tell me more," as they talk about memories. Have a neighbor or a friend with a calm pet visit. Take time to sing holiday songs to spark memories. The progression of the disease usually means that over time there will be increased difficulty remembering familiar faces, events, and tasks. The ability to do some of these activities will be lost. These activities will not return. There may be success at performing the most often repeated tasks, but this is not true for every person. This does not mean that these tasks should be put aside, as the person with dementia may still get some enjoyment from the activity. But the care partner must be careful to avoid anything that may lead to frustration. More guidance may be necessary at the late stages as the person tries to cope and get things done. An activity that will provide a sense of accomplishment to the person with dementia is always important. The care partners must assist and give praise and positive feedback in an upbeat tone of voice in the mid to late stages of dementia. It also must be understood that words may not be understood as much as the way or the tone something is said. As a function or ability to do something is lost, it is important to focus on the abilities that are still present. More guidance and support may be necessary to accomplish a task at this stage, and as the person tries to cope and get things done. Many activities for people with dementia are useful in helping keep them active and happy. Physical activities are helpful in maintaining muscle mass, which is important as some people will eventually experience a loss of fine motor skills and even their ability to walk or be mobile. Activities prevent boredom and may decrease or prevent challenging or negative behaviors. As we said before, the truth is people coping with this illness can still enjoy a range of activities. Medical professionals often stress the need to remain active, not only as a means of coping, as well as to keep the person with dementia and their care partner upbeat. I would like to take time to make at this one last point for activities for seniors with dementia. The importance of music in a person with dementia can make a difference. It can calm them or it can cause a connection to a wonderful memory. Listening to familiar music can make a difference, even in the later stages of dementia. Thank you for joining us today. Activities for people with dementia was brought to you by Caregiver Relief. I hope you will join us in the future.